lower back pain and cervicogenic headaches. And this is a question that I was asked recently about. Is it possible that my low back pain causes my headaches? And usually the first response, even on my part, would probably be no. But then I thought about it, and I just thought of doing this video on the same topic. So, if you are an executive mom and you are balancing your desk job and child care, as in your children, long hours of sitting and poor posture and core weakness can throw off your spinal alignment, and it can lead to cervicogenic headaches that can often affect your productivity and quality time with your family. Now, however, when you think about these headaches, your lower back or your lumbar spine is probably the last place that you are looking at, or one that you would suspect. So, how exactly can your lower back pain impact your cervicogenic headaches, or cause or lead to cervicogenic headaches? It's not common. It's not necessary that every time you have lower back pain, it will lead to a headache or a cervicogenic headache, but there is a mild possibility that it can happen. Now, in today's video, we are going to discuss more about how and why this can happen. Now, before we get into the topic for today, for those of you who don't know me, my name is Swati. I'm an executive mom power coach. I help moms of younger kids who work in high stress executive jobs to manage their spinal, that is back and neck, and nerve pain despite low energy levels and brain fog. So, excuse me. So, I do all of this with giving you simple exercises, some easy lifestyle modifications, some tips and tricks that have helped me in my own pain and adrenal fatigue journey. When I say adrenal fatigue, I'm referring to two main symptoms, though I know adrenal fatigue is a very broad term for those of you who might be familiar with it. So, the ones that I had were low energy levels and lack of focus, which is also known as mom brain or mommy brain or brain fog. And so these are the ones that I talk about. And I do all of this without taking away a big chunk of your time because, hey, we are moms, we are busy people, right? So let's get into the topic for today, which is the link between lower back pain and cervicogenic headaches. Now, as I was saying earlier, lumbar spine dysfunction can contribute to cervicogenic headaches. And how exactly does that happen? Now, when you have pelvic and lumbar misalignment, it can affect your posture, right? So we all know about this. So when you have, say, a anterior pelvic tilt, or you have, okay, let me put it in simple English, when you have an overarched lower back, you tend to pelvis is basically the bony ring around your lower back, around your in the area between your the top of your thighs and your lumbar spine. So that bony ring in between, that houses your bladder, your reproductive organs, all that area, that is known as the pelvis. So right now we're talking about the bony part of the pelvis. So when it is tilted towards the front, that is known as anterior pelvic tilt. Anyway, you don't need to get into all this, but what you need to know is when it is tilted forwards and the lower back arch gets curved beyond its normal limits, it can shift your body's center of gravity forward. Basically, all the weight of the body gets shifted to the front, towards the front. Now, to compensate for this, what happens is, because you got to stand straight, if you are putting the body weight forwards, you're going to fall off. So you're going to fall forwards. So in order to compensate for that excessive forward tilt of the pelvis and that overarched lumbar spine, your upper back and your neck will move backwards. So this is like a compensatory action. It's not a very well defined, I mean, you don't see somebody's spine and you can't really tell unless, yes, it's very marked. But this is something, these are very subtle changes that happen, and that leads to a poor alignment of your spine. It can lead to issues like forward head posture, and that can lead to cervicogenic headache. So let me just get into this a little bit more, because I said your pelvis is tilted forwards, your lower back is arched, and you are compensating by with your upper back and neck. Now, I spoke about forward head posture. So for those of you who don't know forward head posture, if you look at somebody from the side and say they are, most of the people you see, they are on their phones. So if you're not holding the phone in a proper way and you're looking down, so you will see how my face sort of protruded forward. So my head is sort of protruding forwards the moment I look at my phone. You see my earlobe, it falls in front of, this is the tip of my shoulder, so it's falling somewhere in the front of the tip of my shoulder. Whereas if I was sitting in a proper posture, this is the tip of my shoulder, this is my earlobe, they're both in the same line here. So if you have a forward head posture, there is a lot of stress on your cervical spine here. It can irritate or compress the nerves that are exiting the upper to mid cervical spine. And these are the nerves, when they are irritated or compressed, they can lead to cervicogenic headache, dizziness, nausea, etc. So this is the connection between your lower back and your neck. So it's not necessary it will happen every time, but there is a possibility. Another thing is, there is a structure called the thoracolumbar fascia, which connects your lower back to the upper back, and that, of course, is connected to the neck. So there's like a crisscross connection. So the thoracolumbar fascia will, suppose I'm looking at the right lower back, it'll go up to the mid back area on the left. So it's sort of like a crisscross across your back there. So tightness in this fascia will usually happen when you have lower back pain, especially as it tends to get chronic. And that can pull on the entire spine because of those cross connections. It can increase the tension in the muscles around your neck area, especially this upper part that we were talking about, upper to mid cervical spine. That again can lead to irritation of the nerves and a cervicogenic headache, or even brain fog or lack of focus. Now, if you want to go into depth of how cervicogenic headaches happen or what are they, you can have a look at my YouTube channel, and or you can just type my name, Swati Prakash Headaches, and those videos will come up for you. Now, I have also written a blog on the same topic of, can lumbar spine issues lead to chronic cervicogenic headaches or lead to cervicogenic headaches? And in that blog, I have a video that describes more about these headaches and how they're different from other kinds of headaches. And it also gives you some simple ways to manage them. And this management tips that I give you, they are more to do with your lower back pain. So they are pertaining to this blog, this video that we are doing right now. So have a look at that blog. The link to that blog, I will leave it in the description of this video. If you're watching me on Instagram, the link will be in my bio. However, if you're not watching in real time and sometime in the future and you cannot find that blog, just message me. Like, can lumbar spine issues lead to cervicogenic headaches? Just message me something on those lines and I will send that blog across to you. That blog also has a free guide for you. If you're not sure if you have headaches, you're not sure if it's coming from your neck, if they're actually cervicogenic headaches, this is a free guide that many people have found useful, so you can have a look at that as well. Also, I have a course. It's a course on simple solutions to manage your cervicogenic headaches. That link is also present in the blog. It basically is all that helped me on my headache journey, and what I have used to help other people manage their headaches. So it's practical, easy to implement, proven strategies really that actually work. So there is no fluff around it. There's no beating around the bush. It's actually practical strategies and tips that you can start implementing the day you actually receive the course. So, and what will that help you with? You will be able to overcome the pain or manage it better so you can regain your energy and fully engage with your work, be productive at work, be more involved with your kids and your family. Alrighty, if you have any questions, any comments for me, leave them in the comments below the video and I will try my best to answer them for you. And yeah, let me know if there is anything, any of the terminologies that I have used, any of the words that I have used in this video that you do not understand, let me know and I will try and simplify them for you. Alrighty, I'll see you guys next time. Bye for now.